course, what they're doing here at SUNY Downstate and throughout the HHS system. Really kudos to all of them. It's terrific. And for me, what inspired me to get going is I'd always been interested in prevention. And I didn't learn a lot about it during like a lot of years of training. I kind of knew that maybe a Mediterranean style diet was helpful. And I came down to Montefiore to work, to do all the things that I was trained to do, procedures, medications, that kind of stuff, which can be very, very helpful. But people, they got a little bit better, but they didn't get a lot better. And I didn't go into medicine to help people get a little bit better. I was kind of getting disillusioned. And it was right around then, this is in the mid 2000s, that I stumbled across information about a plant-based diet. And actually, Dr. Campbell's book, The China Study, there's a very small section in the middle about cardiology. And being a myopic cardiologist, I went straight to this small section in the middle. And I was really taken by it. And one thing led to another, and started our cardiac wellness program at Montefiore. And I've never seen anything come close to the breadth and depth of benefits that a plant-based diet provides. So it's been incredibly fulfilling. And it was kind of a general frustration with not meaningfully bending the healthcare curve that had me open and ready to start something like that.
Well, one thing I love hearing about all of you is that you're getting to live and breathe that every day, actually change people's habits and actually how they think. It's not just about what they're putting on their plate, but it's actually how they think about it before they even put that on their plate. And that's something that my role currently is limited in, that is that I'm seeing things on the other side, what's happened when it's gone that far. And I love to see, other physicians at the forefront and all of the staff who you all work with. Kudos to all of you for setting that up and then leading all of your staff into it. So, because I know it really does, just like anything else, it takes a village to take care of patients as well. So, Dr. Joshi, actually wanted to ask you a question going from my perspective. As an interventional radiologist, I work actually with a lot of nephrologists. And, the majority of them definitely don't emphasize any dietary or lifestyle changes. They're just putting them on, they get end up on dialysis, and it just becomes an end stage thing that's kind of taking its course. So what are some major plant-based dietary changes that you regularly implement that are very specific for kidney disease?
Yeah, so food that you eat for your kidney is healthy for the rest of your body. Eating plants not only helps with kidney disease, it also helps with all aspects of bodily health, whether it's your heart or you have diabetes or high blood pressure. Eating healthy foods is good for you, gives you the best chance of success. And there's also very specific benefits for those with kidney disease. Kidney disease is a problem that creates multiple other problems, complications. And those complications require pills and treatments, and they can even cause more complications. It's like that Russian doll set where there's another doll and another doll and another doll. And it's kind of like kidney disease. So eating a healthy plant-based diet, just to be brief, because I can talk forever on this and then you'll have to call security to take me away. Plant-based diets can help you with phosphate levels, can help with acid levels, can help you with blood pressure. It can even potentially slow down the progression of kidney disease. It can help with reducing the amount of protein in the urine. So there's a whole host of benefits. And even there's associations, there's observational data suggesting that there's a benefit of plant-based diets even with mortality, which is very exciting.
Anyone else want to chime in there? What are some of your specifics in, let's say, cardiology, for example?
Well, just like Dr. Joshi and Dr. Shah and the other physicians and healthcare practitioners here, we see all sorts of things improve, change from a myopic cardiology perspective. Certainly blood pressure can fall, cholesterol can fall, angina can improve. And we actually just published a very small case series just like a week or two ago, I think, looking at microvascular angina. And it previously had been called syndrome X. And what that is anginal or chest discomfort that all the world looks and smells like angina from obstructive coronary disease, a large blood vessel that has an obstruction. But when you look at those blood vessels, they don't have an obstruction. And it's really the very small rivers and streams that come off of the big coronary arteries that are diseased. And that has been getting more attention of late, syndrome X, easier ways to diagnose it and look for it now. And so we had 2 patients who had syndrome X and, tried all kinds of things. And then we were fortunate enough to see them and they went plant-based and got better. And it's just a small case series. And the hope of that is, of course, that may be a stepping stone to larger studies or people maybe thinking about it as a possible therapeutic in that situation. But it highlights just the panoply of things that can improve with a plant-based diet. And, almost all of my patients have something improved that they didn't expect. Like it's a chronic ache or pain. There's someone I follow who has pretty bad nasal polyps and they get better when that person is on the wagon and they get worse when they're off the wagon. A skin issue, something that we've been focusing on a bit more is erectile function. That may improve. So we see all kinds of things improve, and it really is you just can cast a very wide net.
And Dr. Shah, actually something I'm interested in your training in particular is your practice of addiction medicine. And as we know, certain foods actually have an addictive component. And a lot of what you're doing, as we've been discussing, is not just about just cooking and doing it for some short period of time, although we're proud when a patient can accomplish something for 30 days, but you want to make something sustainable. So in your practice of addiction medicine, what have you noticed in terms of the addictive nature of food and how to get your patients and maybe colleagues and friends and everyone else in your network out of that cycle and into something sustainable?
I feel like when we think about addictions, whether it's addictions to food or addictions to drugs or cigarettes, it's really just people's way of coping with stress or trauma or pain. And people are just looking for a way to heal themselves. And so they're using things that are either, illicit substances like opiates or legal substances like drugs or alcohol or food to sort of heal themselves. And it's, there's healthier ways to, obviously, that we all know that you can deal with stress. And our patients know that also, but at the time when the pain is bad or stress is bad, they reach for the things that they're used to, the habits that they've had over and created over a period of time. So I feel like our role in as physicians is really just to support our patients and really partner with them so that they can actually make better choices for themselves. And so in the addiction medicine world, like we have very good medications to treat people's opioid dependence, or good medications for alcohol or substance use. And with in the lifestyle medicine world, we have very good tools in our kit. We can help people with sleeping better. We can help them with managing their stress through meditation techniques or yoga techniques. We can focus on their diet and hopefully give them, introduce more foods into their diet that's going to help them feel better and cause less pain or inflammation in their body so that they actually feel like energized, which is what happens when a lot of people start eating more of a plant-based diet. And with all those changes, that they can make better changes, they can make better choices for themselves. And I feel like in both of those worlds, it's like, well, what we're trying to do is really give them more tools, give our patients more tools so that they can make better choices for themselves and that they can really heal themselves because they're the ones that are in charge. And when you do something like lifestyle medicine or addiction medicine, it's really, it's really all behavior change, right, that we're doing. And so that is something that takes place over time and it comes from the patient. They're the ones that set their goals, they set their actions, and we're just there to like support them. And we have lots of tools to help them. But they're the ones that are in charge. Yeah.
Thanks for that. One thing that I'm thinking about as I'm listening to all of you is that you're not the only physicians who meet with these patients, right? So you may be the one who's advocating for their diet and lifestyle, but the other ones they're seeing are not talking about that. And you're the one who's, like the waves are crashing and you're trying to hold up the house. You're trying to, the sandcastle that's been built, you're trying to keep it up. And then everyone else is just kind of knocking it down. And I think that's one thing that patients face, and it's a big challenge. And I'll just give you an example of one of my old partners. He used to tell me, he said, if you keep talking to patients about a plant-based diet, we're not going to have stents to put in their legs anymore. And this is someone I really respect a lot. And he trained me. And I said, well, why don't we, what if we could prevent that? And we know we're still going to have the business, but because it's going to be needed. But what if something we could, hit at the front? And that's the type of thing. So I know that just in medicine, that's what we're facing all the time. So what I wanted to know from all of you here is, what about your colleagues, physicians in your own departments or maybe other departments? How's the reception been? Anyone can answer that question.
I can talk to our colleagues. Actually, I think most people here know that in med school, we don't really get that much training in nutrition. And we all sort of stumbled upon the information ourselves, and then we're kind of self-educated. I read the China study, and then I read one thing led to another. I read Neil Barnard's book on how to reverse diabetes, and Esselstyn's book on how to reverse heart disease. And then when I started sharing that information with patients and I started seeing them actually improve their health within months, being able to get off of their medications, feeling energized, losing weight, having it was really it was so rewarding. And it was really impressive. And I remember thinking, wow, I can't believe we didn't learn this stuff in medical school. I can't believe in all my training, we didn't hear about this information that's so powerful. And it's such a great tool to have in our arsenal, especially in primary care when patients come in with lots of feeling tired and they feel like their joints hurt. They just feel not energized. And they always want to know what's wrong, we would always check their blood count and their thyroid. It was normal. Then we don't really have any good suggestions, like take a multivitamin maybe, or, go get some exercise. But when you actually go in and you're able to take a diet history and you realize that there's no fruits and vegetables, or there's no the foods that they're eating are not sustaining their health, it's really great to be able to help them. And in terms of our colleagues, I feel they're very busy treating the cardiac, the cardiologists are very busy treating the heart disease that maybe they might not have enough time to spend on, counseling patients. And so that's where I feel we can come in as internists or, as providers, we can really fill that niche with a patient where they're not really getting that information from their other specialists. They're seeing the neurologist for their stroke, or they're seeing the cardiologist, or they're seeing the specialist, but they're not really getting what is causing all the these series of chronic problems. And so it's really satisfying, I feel to be able to work with them. In our program, we get a lot of referrals from primary care physicians who also, because we've done a lot of work with our colleagues and everyone sort of believes in our system and the power of plants, but they don't have the, like Shivam was saying, you just don't have time to talk about this with patients. They're very excited to refer patients to us so that we can spend a lot of time with them, and our health coach and dietitian can work with them because it's very intensive. And you can see lots of benefits the more you're able to work with someone. But we also are getting referrals from cardiologists and from neurologists also to treat patients, because in every guideline, every American Heart Association, the American Association of Endocrinology, the way to treat their chronic disease that's specific to that profession is always lifestyle medicine is the first thing. And so, but it's very limited time what you get. So they're very happy, I feel to refer to us. We haven't yet had that friction kind of, where we're taking away someone's business.
Okay. Anyone else?
Well, I think Dr. Joshi and Dr. Shah really hit on a very key point, and that's nobody has time. The system is not built to counsel patients appropriately about lifestyle. Nevertheless, it does sadden me and frustrate me the lack of reinforcement that we'll get for these kinds of initiatives throughout the medical system. And it's largely driven by time and limited exposure of the physicians during all of their training. They don't really know a lot about it. In fact, there's a very interesting article by Dr. DeVries where they queried something 600 cardiologists, and they 90+% of them said they thought nutrition was important for cardiovascular health. Okay. But something 2% felt like they were appropriately trained to be able to counsel patients. There's huge gaps, and people recognize it. But what's inspiring for me are these conversations, these kinds of audiences, these kinds of discussions, because we're not going to necessarily change the time thing right away. But when I see a patient in clinic, I can talk about it with them, And then maybe the gastroenterologist, they're super busy, but maybe they could weave in 15 seconds of, it's really important. I really want you to eat your fruits and vegetables, your whole grains. Okay, great. Here, 15 seconds there. They see the physical therapist, they do what they have to do. And they mention how important the nutrition is, even for 15 seconds, but they start hearing it from multiple people, multiple directions. And then they have these wonderful programs like the one at the HHS system where it could be much more intense. So it all supplements each other. We all don't have to, what do they say? Many hands make light work. So these kinds of conferences inspire me and help to quell the tide of frustration that I may feel when it feels like you don't have your posse with you.
Dr. Joshi, what about your reception? Maybe some other nephrologists or other individuals in other departments. How's the reception been from them?
Yeah, I think we are lucky perhaps in the Northeast to have this, or in New York City where we're a little bit more forward. In other parts of the country, and even in New York, you get people who don't believe that nutrition is in the purview of a physician, that physicians should not be doing that. The irony is that if you go on to have this conversation further, who should be talking? They'll say a dietitian, but to see a dietitian is not always covered by insurance. That's like the big cruel twist of this health system, is that what is covered and what is reimbursed is seeing a physician, medications, procedures, but not this underpinning, this basic education of how to eat healthy. And it's so unfortunate that you have physicians who don't even want to talk about it, don't even want to listen to this information. But I think that is changing as a new generation of physicians is in training and is coming up, and they're the ones like us giving talks and things. We're believers. A generation ago, how often were these conferences being had? Probably, I don't think there was any. So hopefully the next generation will move from conferences to, in the clinic, and maybe it'll be reimbursed.
Just want to add one thing. We're also benefiting quite a bit from societal trends, as you all know. And when we started our program, I don't know, like 10, 12 years ago, and I would mention to patients about a plant-based diet, one based in the Bronx, and people come to me in two general buckets. The larger bucket is they're part of our system and they need cardiology care for whatever reason. And then the smaller bucket is they somehow heard about our wellness program and they come to see us for that. The people who come to see us for the wellness program specifically, they're already on second base in terms of lifestyle change. But the ones who come to see us for, just regular cardiology stuff, they're not. And 10, 12 years ago, if I mentioned plant-based nutrition, not infrequently, they would look at me like I'm from Mars. Like they would have never heard about this stuff. But it's slowly been changing. And now they don't look at me like I'm from Mars. People have heard about it. It's part of the vernacular. So we are benefiting from societal level changes as well.
I can definitely echo that sentiment, Dr. Osfeld. The number of times I've sat with a patient so I treat a lot of uterine fibroids. The African-American population, I think 80% of women are affected by fibroids, and about 50% actually require some type of treatment, some type of intervention, whether it's a uterine fibroid embolization, which is what I do, or surgical myomectomy or hysterectomy even. And what's interesting about it is a lot of my patients will ask me, what could I have done to prevent this? And while there's no definitive data for uterine fibroids and a plant-based diet, we know it's a very estrogen responsive tissue. So I start to talk about that with them. The amazing thing is, when you talk about someone looking like you, like you're from Mars, I find that less and less over time. And especially with these patients, they're so motivated because it's the only medical problem they have. And they say, well, what's the one thing that I can do? And it's amazing. They bring it up on their own all the time. I'm just like, so what do you eat? Well, they said, oh, I've started to cut down meat and dairy and all. And I'm like, I didn't even talk to you about that. And I asked them, did your physician talk? No, no. I just figured it was the right thing to do. And I'm hearing that more and more. And I think that's all of your efforts. I think it is really expanding. I think it's becoming more popular. Social media is making it a lot easier because more athletes, which I know there's another session going on right now, they're discussing that, musicians, actors, everyone who's out there. So you're kind of hitting it from all angles. And I love that it's all happening right here.
And I think that touches on what one of the audience members was saying earlier, that 8% of African Americans are vegans, which is higher than non-African Americans. And it's basically kind of just undoing the social injustice by doing so much right when there's been so much wrong with just one single act. It's like an act of protest, but also empowerment. And it goes to kind of what you're speaking, that I think this knowledge is progress. So that's why people, you haven't talked to them, but there's people are starting to hear it, which is amazing. And it goes with what Rob was saying, that if everyone just keeps saying the same thing over and over, it'd be like smoking. You know it's bad for your health. You should stop doing it. And maybe, you know, eating healthy would be that movement.
So how about so when we're talking about colleagues, how about other, because we want to see where can this go? It needs to come from bottom up and top down. So when you talk about top down, with physicians, how about irrespective of your physician colleagues and the management of a patient, have any of your colleagues in other departments actually been inspired to change their own diets and their lifestyles? Anyone?
I can just speak. When we first learned about this information, like the power of plants in your diet, and by we I mean Dr. McMacken and I, who's going to be speaking later on. She's my colleague and really good friend. And when we started understanding like the science and the evidence behind eating this way and sharing it with our patients and realizing like, oh my gosh, this information would be so useful for our colleagues, they were super receptive. We were able to get a grant to get a curriculum, to create a curriculum on evidence-based nutrition for our colleagues. And we focused on the power of lifestyle medicine and specifically looked at cardiovascular disease and obesity, diabetes, and cancer prevention and how diet impacts those chronic diseases. It was eye-opening. It was eye-opening for us and it was eye-opening for them as well. And not a few of them, maybe like 6 became much more plant-based. Maybe 2 became vegan, but like many became more plant-based and definitely were starting to talk to their patients about it. I think that it was just a lot of it was just a knowledge deficit, and so by correcting that, I think it makes a big difference.
Yeah, it's been really fun to watch these changes, and they manifest in a variety of different ways. I mean, some of our cardiology fellows, initially they rotate through a lot of hospitals, and they're with us for 3 years. And, maybe for the first year or 2, they may laugh at me or joke around about plant-based nutrition, whatever. And then not uncommonly, like I won't see them for 5 or 6 months because they're off rotating in other hospitals and things, and they'll come back and they're like 25 pounds lighter. And like, I went plant-based. I'm really happy. So that happens regularly. And there's a lot of like side conversations. I mean, it feels like things are changing. Like I know when I walk through the cafeteria, I can see people watching me when I get. Like there are one of my macho colleagues pulled me aside just the other day, and he wanted to really dive into plant-based nutrition. Gave him some resources and stuff like that. Certainly, people will pull me aside, in the hallway and talk about how they've started doing it more and the kinds of benefits that they've seen. So it's conferences like these discussions, the documentaries, the societal level change, our individual small initiatives that all work together to make these things happen.
Dr. Joshi, any success stories or resistance either way, maybe from some colleagues in their own lifestyles?
Yeah, I think I feel like I'm kind of young at this, so I feel like I have an example as well of joining, working with Dr. McMacken and Dr. Shah, that I've been more confident in my approach with patients. I think it's rubbing off on other people. If all it takes is just one person to plant the seed, and then it kind of spreads that, oh, you're doing that. How do you explain that to a patient? And just and then it's like wildfire.
Yeah, absolutely. So I want to move to another topic that's in particular your interest. And Dr. Rosenfeld, when he was showing his slides, had shown all the various types of diets, keto and South Beach and Atkins and plant-based and whole food plant-based and vegan, all, I mean, it just goes on and on and on. So I know you have a particular interest in fad diets. And what I wanted to know from you, from your research and experience with that is, which diets do you think are particularly harmful or at least too difficult to sustain?
Yeah, so diets that are particularly harmful are diets that don't include the healthiest foods on the planet. What are the healthiest foods on the planet? Healthiest foods on the planet are your fruits, vegetables, whole grains, beans, lentils, nuts, seeds, all these things. If you don't have those foods in your diet, it's hard to say that your diet is healthy. So some diets are extremely restrictive and exclude these foods, like the ketogenic diet. There are ways to do the ketogenic diet in a healthful manner. Some people have reasons, individual reasons to be on these diets, and there are ways to modify it within, so you're maximizing the potential benefit. But it's been written time and time again, the most healthful diets are your diets that have these whole plant foods, minimally processed, not a lot of added sugars, not a lot of junk food. These are the healthiest foods you could possibly eat.
And what about sustainability?
These foods are also extremely sustainable. Sustainable in the environmental sense. The Eat Lancet report made that pretty clear to physicians worldwide, that we are in the midst of a climate catastrophe, and we need to think about how we get our food, how it's produced, the environmental toll it takes. There's been multiple studies showing that the food that we use to feed other animals, other beings, could ultimately be diverted to feed humans and reduce global food costs and things like that. Also sustainability in the sense that can you stick with it, which is your point. Any diet that's not sustainable for you. So, people drastically cut calories. That's not sustainable because you get hungry later. And the point is not to go on these crash diets where you rebound. The point is to eat a healthy dietary pattern. In order for it to be sustainable, there's two components. Is the diet itself, are you doing something too unrealistic? But also, do you have enough resources to do what you're intending to do? So the diet that this conference is focused on is eating this healthy diet. It includes all these extremely healthy foods. But in order to keep it sustainable, you have to have these resources or put yourself in a position that you can be successful. The diet, when I tell patients, I see a lot of patients that have kidney disease. When I tell patients that they can eat these foods again, to them it's liberating because they've historically been told they can't eat these foods. And what I find, even for patients that don't have kidney disease, is that have you ever eaten quinoa? And they look at me, how do you spell quinoa? And then, we talk about quinoa and, it's and their mind is blown. Or, talk to them about tofu or tempeh or seitan. And it's amazing. People are taking notes, they're excited, they can't wait to try these recipes. Our concept of a plant-based diet is a banana and a salad, or a couple, not even a salad, just a couple of leaves. That's not sustainable. To make it sustainable, you have to have this knowledge and basically relearn human diet.
So Dr. Shah and Dr. Osfeld, I would want to hear from you as well, because that's the challenge that I really face when people ask me is, okay, I can do this for a little while, but how do I sustain this? Because I'm really getting tired of minimizing the use of this or having to add this thing that I don't really love. Like, how do we really inspire our patients and our communities to make this a lifelong change?
I mean, I feel like that's the $1 million question. We all know behavior change is the key, and it's super hard. We all kind of know that eating kale is good for us, but getting ourselves to do it is often another thing. And just tangentially along the lines of sustainability, like, who cares how healthy you are if there's no planet, no health. So these things go completely hand in hand, of course. And I wish I had the secret ingredient for how to keep people on it. People go off the wagon, on the wagon a lot. And things that I found to be somewhat helpful are, what's the person's why, and that can change. Sometimes they want to lose a little weight to go to a reunion, or maybe they want to avoid a certain procedure or come off certain medications. And then maybe later on that why changes, but staying on top of that and evolving why eating more healthfully can help them with that. That's one, they're evolving why. Another one is not making perfection be the enemy of good, because there's ample studies that if you go even, 75% of the way toward a plant-based diet, or, every little bit counts. So, and, people sometimes beat themselves up if they fall off the wagon the littlest bit, and then they'll just collapse. So, letting people know that don't let perfection be the enemy of good. And then there are larger issues that it's wonderful that Mayor Adams, Rachel Atchison, the HHS system are tackling. And that's on a societal level, making the healthy choice the easy choice. And there are a lot of headwinds. We're taking on the farm bill, billions and billions of dollars. It's largely supporting animal agribusiness. There's a fast food restaurant at every corner, and it's not kale. So, and they're cheap. So there's a lot of societal headwinds that we need to take on. So really, it's going to take a village to turn this around and to make it more sustainable. Because sometimes it feels like it's just a small number of us, like if someone makes this change, that person is taking on all those headwinds. And it's great when they can build a community, but we really need all hands involved.
A planet, if you will.
Yeah. I definitely will echo like the importance of having a community, because it's really difficult for people to do this on their own. I was fortunate enough when I became vegan to have my family, a lot of people in my family also became vegan with me. And so when we go to family, hangs and gatherings, there's always vegan options to eat. And so it makes it easier to do that. If you are the only person in your family who's eating this way, it's very difficult to imagine that that's going to be sustainable, because it's isolating. Food is like a community kind of activity. So if you're going to be doing that by yourself, I don't know how it can be sustainable for that long. So I think it's really important to get the family involved and to support them. And if it's not their family, then at least getting them connected with other people who are also eating this way and sharing this experience with them, because you don't want it to be isolating for someone. It's, one of the true pleasures of being in the plant-based lifestyle medicine program is we have, we're able to see patients regularly, but we have the health coach and the dietitian who are able to really help troubleshoot a lot of the problems that people are facing. How to meal prep, how to batch cook. Like some people, all they need is information and they take it and they run. Like my original patient who had diabetes, and I told him to read the book that I read, how to reverse diabetes. He read it and he made the changes, and he was off his insulin and off his cholesterol medications and lost 30 pounds. Like he just needed the information, but there are other people who need a lot more support. How to cook this, how to cook, how to meal prep, how to batch, how to go out and eat with friends, and how to go out to eat at restaurants and eat healthy, how to gather with friends and not be, and still maintain a plant-based diet when you're with family and friends. So I feel like they're able to help troubleshoot, and so it would be great to have, to have that provided for more people, like that kind of support.
Yeah, you're right about the community aspect, because with the sheer number of plant-based or vegan restaurants now in New York City, it's just growing. I'm sure everyone here has been to a number of them, and it's just, you can't even believe you're eating this, because for all of us who have not eaten that way our entire lives, you ate a certain way and you just love that thing, and now you get the vegan or plant-based version of it. You're like, what? I can't even believe I'm having this right now. I didn't know this was imaginable. And then you start bringing people who don't normally eat that way, and they want to come try it with you, and it just keeps in sort of a ripple effect. So I definitely agree. The community aspect is huge. Mm-hmm. So what I want to ask, this is actually for Dr. Shah and Dr. Joshi, and then Dr. Osfeld, you can give your thoughts on this. What are the criteria actually to be accepted into the program? I'm sure it's just not everyone can, just come in and say, I want to do this, because there's lots of community, as we talked about, PPMNY, for example, they're doing a fantastic job just for basically anyone and everyone out there. But to be specifically in your program, in the sort of the more clinical setting, what are some of those criteria?
Honestly, everyone can benefit from a plant-based program, but because it's a limited resource, we had to limit it to people who have have chronic diseases that we know can benefit from being on a plant-based diet. So it's known cardiovascular disease, diabetes or prediabetes, hypertension, or a BMI greater than 30, and they want to lose their weight. It used to be BMI greater than 25, but it was with limited resources. We just wanted to restrict it to people who have obesity so that we have more, we can benefit them more. And there used to be hyperlipidemia used to be a category, but we had a lot of people who were trying to use lifestyle medicine as the only way to treat familial hyperlipidemia. And for certain people, they do need to be on medications. And so we were trying to discourage those patients from, just using lifestyle medicine as a sole treatment for it.
Sure. Okay.
And they also have to be willing to, it's a pretty intensive program. You have to be able to make the meetings with the physician and the dietitian and the health coach and all the group visits. So they have to be willing and able and interested in really wanting to make a lifestyle change. And no one has to want to be plant-based completely, but they just have to be open to changing their diet in some way, and trying to introduce more plants into their diet.
And we ask that patients have a primary care physician because if you don't have a primary care physician, this is the first time you've seen a doctor in 10 years and you have diabetes, a lot of the time goes into dealing, with, we need to make sure you don't have a stroke or a heart attack or go into a diabetic coma, within the next 24 hours or a week. And that takes away from talking about the health conditions. And so we really want to dedicate that time to talking about a lifestyle change.
Okay. Dr. Osfeld, what about you in the cardiac wellness program? What are some of the criteria?
So it's pretty much anybody with a cardiac diagnosis, and that's really largely from billing requirements from my system, which I should say has been incredibly supportive, letting me build and grow this. So I feel very fortunate to be able to work there. But it's any kind of cardiac diagnosis: high blood pressure, high cholesterol, heart failure, coronary artery disease, palpitations, things in that category is what they try to screen for. They don't always get it perfectly, but that's really simply for billing purposes. And so, the people come, the bucket of people who come to see me who are there just for a cardiac reason and have no idea that we have a cardiac wellness program. They're there largely, they have a cardiac diagnosis, and it's occasionally someone who knows about our wellness program where who's coming, they wish to come to it, where it may be slightly harder to fit them in.
I think we're now in a position, especially since this pandemic, where healthcare providers, and this is, physicians and extenders, nurse practitioners, PAs, nurses, everyone involved, top to bottom, has been at the forefront of this whole thing. And I think now we're in a position where we can be a, very strong voice, although there's a lot of conflicting, we're always having to battle that too. What's real and what's not, right? But the good thing about this, I think, with the plant-based diet and this approach is that you never get that sense of there's an ulterior motive here. And I think a lot of medicine, a lot of people who are not in medicine face that, and they're saying, well, what is their end game here? And I think what's really nice about this particular way of eating and way of living that we all do and espouse to other people is that there's no broccoli lobby, there's really not. And there's nothing that's really in conflict except sort of the big businesses who lose by us doing that. So I think that's what really incredible that all of you have formal programs that's being done. So in that regard, and anyone can answer this question, what are your vision, what do you envision for the growth of your particular program? What do you see in the next, 5 to 10 years?
I personally, because we have such limited access, and not everyone is going to be able to have access to a lifestyle medicine program, nor does anyone want to necessarily come in on a weekly basis or for classes. But I would love to have this available, the information available for patients, so that they would be able to access this at their own time, do a self-study at home, maybe access like somehow come up with a curriculum that we can offer to patients. And that they can study or they can kind of review it on their own. And then they can ask their doctor about it so that they have all the information on the importance of sleep and physical activity, plant-based diet, how to make it happen. And then they can do it on their own. And then I would also really love, because, we didn't have this opportunity to be able to, see a lifestyle medicine practice I would love to have people be able to rotate in our program, especially med students and residents and other practitioners, just to see how lifestyle medicine is actually done in practice, and the benefits that you can get from seeing that. Because it's like, once you see patients who get better, and it happens regularly when they start making lifestyle changes, it's really like infectious. And we're all in here for making sure that we're in this business because we want to help patients feel better. And it's super rewarding to have people feel better, feel energized. And, it's really rewarding.
Anyone else? What do you envision?
So always the hardest thing about the future is predicting it. There are, as I think about it now, 3 things that I hope that I'll be able to accomplish in the coming months or short number of years. One of them is continuing to grow the research aspect of our wellness program. And we're about to launch a randomized trial looking at the impact of dietary pattern on erectile function. And we don't know what it will show, but my hope is to do projects like that have the real potential to impact behavior change, where we have limited resources. So the kinds of projects I'd like to do are ones that could hopefully be, impactful on behavior change. So that research aspect of growing it, and that study will be the cornerstone. Within our hospital system, and I'll describe this more later, we do have plant-based meals that you can use for inpatients. And, people can choose whatever kind of diet they wish to order for the patient. But I'm working to make that the default diet in multiple settings. So I would hope to have that much more widely expanded in the coming months to early number of years. And I have the opportunity to work with some wonderful colleagues with help from the American College of Lifestyle Medicine, with Annalisa, a music therapist, and Dr. Ryder in pediatrics, where we are trying to weave lifestyle medicine seamlessly, silolessly, and more broadly throughout our entire system, getting to the theme that we were talking about before. Like, I'd love to have the orthopedist, I know they're busy taking care of the knee, but say, hey, more fruits and vegetables, maybe you lose weight, less inflammation, may help the knee. Then they go see the nephrologist and they talk to the nurse and they mention it. And it's just a lot of hands making the work a little less heavy. So we're hoping to weave that in a thematically throughout the system, but also in a structured way as well.
I would like to see more of these programs in more places. We've been lucky enough to have this at the H&H system at Montefiore, but what about the rest of America? The 5 to 10 years, I think we should have programs like this, plant-based options, healthy food options in hospitals. This, I want to see this become the standard.
Yeah, I think these efforts, especially in a city like this, where the rest of the country really does look to, since it's happening here, I do definitely believe it can happen in other places. It tends to happen happens to here in California, and then somehow over time it all meets in the middle. But I think, again, going back to how rapidly information changes now and how widely available it is, again, with media and everything, you can just see what's going on. And it's interesting. I'm sure we all have these experiences where you talk to people from various parts of the country, even in small towns, and you find out that they eat this way, and you're like, oh, and they ask them, what options are there? Like, nothing. I just learned to make it on my own. And I said, how did you find out? And they say, name someone who, you actually kind of follow and you get to see, and they're that example. And I think this is where it all begins, but you're right. It has tons of potential to expand. Just curious, actually, by a show of hands, because we've been talking about, Dr. Shah had mentioned this about having trainees rotate through there. And I know there's a number of med students here who've done a stellar job of promoting this. And I know in the Bellevue system, there are med students who are pushing this forward. For those who have a medical background of any kind, doesn't matter what those letters are behind your name, any medical background, how many of you actually had some formal training in nutrition or lifestyle? That's a very small number. I only see, I think, two two, oh, three, four, maybe four of you, but I think some of you are dietitians as well. At least one or two of you are. So obviously that's gonna make sense from your perspective. But what you can see is that those of us who are physicians for sure. I mean, none of us raise our hands, and I think that's where the reins should be taken. Should be given rather to those individuals who can then lead us forward into this. So I think everything that you all shared with us, we really appreciate it. It was fantastic. And what I'd like to do now is open up the floor to anyone who'd like to ask us some questions in the last few minutes that we have. Sure, come on.
Great afternoon. I'm Reverend Marilyn Jackson. I serve on the Plant-Based Metro New York Advisory Board. First of all, I want to thank the physicians for being here today and sharing in your time and your knowledge and in your understanding and supporting this as we all work together to bring this forward and just make it the norm. My question is anyone aware of a plant-based program where someone can go and live there for a few weeks to transform?
A couple quickly come to mind. There's the True North, I think is Northern California. And I think they do things like water fasting, but also have a plant-based option, I believe. I think there's the Pritikin program in Florida. I think people can go there. And there's a variety of plant-based physicians who have retreats for these things. Like I think Dr. McDougall has a plant-based retreat. And there's another one that I apologize, I'm blanking on right now. So those are the ones that I know of.
Thank you. I'll look into that. Thank you.
Hi, and my name is Ala Kilis, and I'm faculty from family medicine, and I am diplomate of lifestyle medicine. So in our dream, we envision one day to have programs similar that we have in Bellevue. We can just hope that we will get enough support and we will find resources. But I just so that's why my question is very practical. Number one, your residents included somehow? Do they work with you? Do you have this formal, could you implement this formal curriculum from ACLM?
Currently don't have residents right now rotating, but we have one that's expressed interest in making the lifestyle medicine one of her primary care sites. So starting in like a couple of months, she'll be working with us. And so we hope to open it up. We've had medical students kind of come for one or two sessions when they can. But it would be, we don't have a formal curriculum.
The primary care social medicine program, part of Montefiore, it's my understanding based on emails and brief conversations with their program director that they have woven in a good bit of the American College of Lifestyle Medicine curriculum for those residents. And as part of that larger system change that I'm having the chance to work with Dr. Ryder and Annalisa, we spoke with ACLM about it. We hope to be able to incorporate some of their curriculum into it. And as you know, different subspecialties may have more or less interest, like family medicine is probably a lot, neurosurgery, probably less. So what we're hoping to do is even for those programs that may not have traditionally much interest, even getting 1 hour of a lecture a year for those residents to just begin to all, the rising tide raises all ships kind of thing.
And my second question, from administrative perspective, is it in terms of, is it just financed by the hospital and they just sort of let and supported physician to dedicate time? Because again, from busy practitioners, I suppose it takes much longer time communication, and I'm not sure how billing works to justify the services. So any input on that?
That's a good question. The question is about in terms of how to support physician time in a program like this. Initially, when the funding happened, it was to support the physician's salary. And so it was one session a week for the year for the pilot program. And then that became permanent. So it's funding for physicians for doing one session a week in lifestyle medicine. And then the billing is how you would bill regularly for seeing a primary care visit, because it is a primary care visit. And the dietitians would be doing their billing as they would with any other, with any other insurance. And so each insurance pays differently for dietary visits, depending on the chronic disease. Some pay a lot, some only allow for 1 or 2 visits. So it really depends on how that is. And then the health coach is supported. That is not a billable visit, but it's supported in the program.
So much.
No problem.
My name is Hannibal Miles. I'm a naturopathic physician. My question is, do you find yourself relying less on pharmaceuticals? I know you seeing chronic disease, they're already coming with a lot of pharmaceuticals, but for, I guess, the new patient, do you find yourself relying more on lifestyle medication, lifestyle changes before, going straight to the medication? And also, have you guys found any pushback from the pharmaceutical industry on your programs?
As a cardiologist, maybe my patients are more enriched to be using medications than the other 2 docs here, but first, no pushback whatsoever, nothing. And, I honestly look at it as all of the above to protect people. And the cornerstone is, of course, lifestyle change. By the time they get to me, their disease is fairly advanced. So I most often am using both. There are plenty of times when we're able to wean down or off medications, most commonly with high blood pressure, because what will typically happen is someone, goes plant-based and I get a call in 2 weeks that they're lightheaded. And, that's just because we don't need as many blood pressure meds anymore. And so we'll start to wean those off. So that's common. The cholesterol lowering pills, there's just growing data that lower and lower is better. And so I'm extremely reluctant to pull those off, and growingly less reluctant to even reduce the dose, because that can raise levels. And different guidelines are now pushing for less than 55, and there's even evidence that pushing down to 20 or 30 may even be continual to be helpful. So we certainly can reduce the disease burden, but I personally look at it as all of the above, and the cornerstone is lifestyle.
Good afternoon. I want to thank you guys, especially for your honesty and the wealth of information that you're giving us. My question to you is, plant-based nutrition seems to be helpful in reducing the disease burden, but do we also use it in palliative care? That was my question.
The question is, plant-based nutrition is useful
used
for
in
chronic
palliative
disease,
care,
and can we
yes.
use it for palliative care?
Mhm.
So palliative in terms of malignancy?
Maybe, yes, in other instances also.
I do not personally have experience using it in
Mhm.
palliative care, so my comments will be complete conjecture, but
Okay.
I don't see why not. I mean, if it's going to make, sometimes it can help people's aches and pains get better. Sometimes it can make them feel better. And when they're in that situation, quality of life, it's always important, but probably is even more important at that point. There's certainly data that plant-based nutrition can improve quality of life as measured by the SF-36 score, which is a validated kind of quality of life measure. So from my standpoint, I don't see why not.
And just, anecdotally, patients who have arthritis and inflammation in their joints, we've seen them in our program get significantly better when they follow a plant-based diet and they make changes in their lifestyle. And then I think we've all seen patients with GI discomfort, whether it's constipation or heartburn or abdominal pain, significantly improve when they introduce more plants and take out the processed foods and animal products from their diet. So in terms of, not necessarily specifically for malignancy, but just in terms of relief of inflammation and relief of pain in their body. I feel like there's a significant amount of benefit that can be attained. And
Thank
it's a
you.
really, I feel like that's one of the best aspects of, of treating patients with a plant-based diet, because not only is there maybe diabetes going to improve, but then there's all this other wealth of secondary benefits that happen, like the energy that people feel, they sleep better, they have less GI discomfort, all those things.
Thank y'all very much.
Hi, good day. I have two questions. My name is Shanita Scotland. I'm a personal friend of Mr. Adams. I do believe in a plant-based diet. My first question is, I am a nurse, an ER nurse by profession. I do a lot of education in the 5 minutes that I get with some of my patients. As a nurse who wants to advance education, I was in the DNP program for pediatrics, but I no longer want to do the pediatrics. I want to do more plant-based or health coaching. Do you have a program for nurses who actually want to do an advanced practice in health coaching and plant-based education? Because we see that in our community, especially now in the pandemic, where a lot of people have heart disease and other issues, but they don't go to the doctor. Their first stop is in the ER for the first time in months. And so we have that 5 minutes with them. Do you have a program where nurses can enroll in and be part of that?
So the question is there a program for nurses for understanding and learning more about plant-based or plant-based lifestyle medicine
Yes.
program? And American College of Lifestyle Medicine is an excellent organization where they offer courses.
Okay. Yeah, I know the certification, but I was saying for Downstate in particular, especially for our community here.
The Cornell certification, what's that?
Center for Nutrition.
Center for
Studies.
Nutrition Studies, they have a certificate, and like around Christmas time, they discount it, and so you can get it for a little bit less. Carla Rodriguez, who's not in this session, but she's in another breakout room 3. She's a nurse, but also a professor at NYU School of Nursing. She'd probably be a good person to connect with and ask her this question. You might know some nursing specific resources for you as well.
Okay, thank you. Okay, thank you. My second question is for the cardiologist. I have a very good friend who is a personal trainer and complete plant-based. In fact, he was raw foods and then became vegan. So he's been going back and forth between raw foods and vegan. Last year, he was stented, which was for him, it was just a wow. But he said he has not been sleeping as much. And he was looking to see whether it might be the vegetarian diet with the processed, the meats and so on that he incorporated in his diet. My question for you is, for a person like him who was completely raw foods vegan, now is on medication because he was stented in November. How can he work along with, because he really, he feels like he has to, based on what his doctor is telling him, he has to incorporate further diets into his program now. And his concern is, how does he go back completely raw foods vegan?
Well, I'm sorry to hear about your friend. And, of course, we can't give out specific medical advice.
Not medical
but-
advice, but just from that wellness.
Sure. I mean, there are, and the devil, of course, is in the details with this. There are a variety of, I know it sounds surprising, maybe someone's very in shape and they're vegan, that they had a cardiac event. And of course, as everyone knows here, and I'm sure your friend's extremely healthy, but there, of course, just for the audience, there's junk food vegan and there's vegan, the healthy vegan, and everything in between. And multiple studies highlight how if you're junk food vegan, then that's not really healthy. And then of course, there's the devil of the details of the dietary pattern. Of course, there are a variety of genetic predispositions that a healthy diet may be helpful for, but it's not going to fully overcome, that someone may have that could make them need a stent or other various medications to protect them cardiovascularly. So, very broadly, I don't see why under medical care, meaning adjusting medications, making sure B12 is okay, et cetera, that this person would not be able to be fully plant-based. To me, it would seem to be optimal, but the devil's in the details, and when we unfortunately don't have them right now.
Okay. Would that person, since they don't have all the other illnesses, would that person qualify for the program or?
Well, I mean, if you're asking me, they sure, if they have heart disease, they could easily come to see me in clinic. And I'd be happy to give you the phone number for our clinic after.
Okay.
But so, sure.
We'll do so. Thank you.
Thank you all for sharing your knowledge and perspectives. I'm Francesca Castro. I'm a registered dietitian at Memorial Sloan Kettering. I just wanted to kind of pick your brain and hear your thoughts on sometimes, specifically, I would think postmenopausal women who are often chronic dieters in the past and then adopt a plant-based, whole food plant-based diet, and then they don't see the results as quickly as other patients. And sometimes that's their why as to why they're entering this diet to lose weight, and then they kind of, it's more slow for them. What would you suggest to like keep those patients motivated and keep them on the right track?
I love this question. I've been talking about this very issue with a number of patients in our plant clinic at Bellevue. Before I get to that, you should connect with Dr. Urvi Shah at MSK.
I work with her.
All right, we've gotten that out of the way. Yeah, it's very difficult, and unfortunately for postmenopausal women, middle-aged women, you're working against biology. Unfortunately, metabolism slows as we age, and unfortunately for women, women have a lower metabolism than men. So when you calculate, there's actually free calculators online that NIH has. When you calculate metabolic needs for a postmenopausal woman, it's surprisingly low. And especially if you have a short stature, you're a small frame to begin with, it can be as low as 1,000 or 1,200 calories. And if you're still eating a 2,000 calorie diet per day, you can easily see that you might actually gain weight as opposed to losing weight. There's many pillars to lifestyle change, pillars to wellness. One of them is diet, but another important pillar, especially for this patient population, is exercise, not only cardiometabolic, but also strength training. Strength training builds muscle, helps increase metabolic rate. Also, the cardio also helps burn calories. I think both of those aspects of exercise, physical fitness are important. And I really spend a lot of time talking about it because this is also a different demographic that is difficult to engage in physical activity. They may have or orthopedic issues, they may have joint pains, they may not have ever really engaged in physical activity. So to tell someone to go buy a bike or do Peloton, it can be difficult. You have to find something that's engaging for them. I don't typically count walking as exercise because all of us walk, and because we have been walking, we kind of are in this place, and because we're not doing something else. So I really push and try to encourage people to do more than that. Find something that's engaging for them. It's good for the mind, the body, the spirit, everything.
Thank you.
My name is Mavis Osamobor, and I'm the health director for my church. I have two questions. One of them is, how receptive is the insurance industry to what you do? And then I have another question after that.
Not very. I mean, I wish they were. I wish they were more receptive. It can be difficult to get them to pay for some of these services. What they pay for is inconsistent. They don't pay for all the things we would like them to pay for. For example, to see a dietitian, you have to have certain qualifying criteria, diabetes, and then I think it's limited 3 sessions per year, and you have to have a certain stage of kidney disease in order to see a dietitian. We are not, as physicians, not reimbursed for counseling, or there's no billing code for this, and it's difficult to do it in a standard model when you're seeing patients every 15-20 minutes. You can bring patients more frequently. That's what we try to do, but we would like to see this landscape change.
If we prevent a stent, the hospital system gets next to nothing. If we stent, the hospital system gets quite a bit more than next to nothing. So the incentive system from a reimbursement pattern is not geared to wellness. But hopefully with societal level changes, et cetera, things will change.
Okay, thank you for that very straightforward and honest answer. My second question is how receptive is the cancer treatment community? And it's a sore point with me because my sister died of breast cancer about 6 years ago.
Sorry.
And I feel that some education about how diet could have impacted her situation might have made, I don't know if it would have saved her life, but it probably could have extended it. So I'm very interested in knowing what kind of reception you get from the cancer treatment community toward what you're doing, whether they have any faith in its efficacy at all, or they like, let's hurry up and get the drugs in there. So, and I'll sit down and take the answer.
I'm so sorry about your sister. Yeah, I think it's very individualized. I think that the probably the oncologists who are aware of like the power of diet in terms of prevention and treatment of certain cancers are probably more likely to use it for their patients. And if you're not aware of it, you're probably not going to understand the benefit of it. That's what I've seen when my patients have gone to see oncologists and either they have or they haven't been counseled accordingly. And I think it's just really like hit or miss.
Good afternoon, everyone. My name is Teresa Brereton. I'm a registered dietitian. And I know there is evidence that reversing type 2 diabetes with a plant-based diet. What is the literature or evidence on reversing type 2 diabetes in end-stage renal disease?
I was gonna make a joke and say you're so lucky to have Dr. Shah answer that question, but then you added the end stage this part at the end, and so it's a good question. So the end stage renal disease makes it a little more complicated. But like I said, eating these healthy foods not only affects one part of the body, so eating for diabetes and then eating for kidney disease, if you try to think of it that way, it makes it complicated. And this is actually where many patients get confused because what the standard is now is actually to tell two different things. You're supposed to eat white bread for kidney disease, but not eat white bread for diabetes. And so many of my patients have come to me confused. What we're trying to do is define the paradigm, change the narrative and say the foods that you should be eating or the foods you should be eating all along are these healthy plant-based foods, fruits, whole grains, vegetables, legumes, nuts, seeds, things like that. If it is possible for some people to reverse diabetes, if it's mild, hasn't been long-standing, it's attributable to weight gain. For other people, it can be more of a challenge. Overcoming that metabolic syndrome may not be within their reach, but what we say is that you don't know how much you can improve it until you try. You may not be able to reverse it, but you may be able to get off some of these medications. You may be able to bring that hemoglobin A1C number down. And by doing so, you may also improve some other aspects, like I was saying, the complications of end-stage renal disease. But end-stage renal disease makes it harder because many patients after dialysis don't have an appetite. And when they do eat something, they just want to eat what they want to eat, maybe not for long-term health. The other issue is that end-stage renal disease is a chronic inflammatory process. So it makes it harder for the body to heal. So there's a lot of challenges there.
Thank you. And I just want to thank the team for the wealth of information disseminated here this evening. Thank you.
You're most welcome.
Thank you to all the panelists for such an informative session. I have relaying a question from one of our Zoom participants. So Vic is asking, can you discuss plant-based sweeteners and alternatives to sucrose/fructose? Sweeteners are probably important components of diet. Good sweeteners may increase compliance, quote unquote, and may help lower blood sugar problems. What does your experience suggest?
Yeah, I would say to stay away from the sweeteners in general. There potentially is a role to using non-sugar sweeteners and transitioning, kind of like using the faked meats or the process, some of these things in the process of transitioning. But you don't want to develop a habit where you're used to eating these sweet things. What I've noticed by giving up sweeteners and sugar, I relish, a fruit bowl. I mean, it's, to me, the perspective of eating a mango or a pineapple when you're not accustomed to eating these super sweet things is absolutely mind-blowing. And that just positively reinforces you to eat more of these naturally tasty and healthy and sweet foods.
Thank you.
One thing I can add to that is that in this question comes up a lot about sugar consumption, and sugar has been so demonized, but when it comes in its natural form, and with things that are with fiber and your pancreas knows how to manage it, it's actually wonderful for you. I'm as an interventional radiologist, I look at a lot of PET scans, and with PET scans, we actually bind this nuclear drug to glucose. And you can see the brain light up. The brain is entirely orange when you look on a PET scan. That's because of all the glucose in there. So I always show people, don't demonize glucose. Your brain is requiring this to function right now. It's just in what form is this sugar coming in? That's what's really important. Last question.
I am Dr. Man, OBGYN from Brooklyn, New York. About the omegas, there seem to be two camps on the omegas. There are those who take supplements, and there are those who advocate just taking the precursor form of the omegas in nuts and seeds, etc. What do we tell our patients? What do we advise them to do? There's no formal recommendation by ACLM to take omegas, but there is a recommendation in the Bellevue Diet book to, yes, take an omega. I would like the panel's recommendations. What do you do personally? But what do you tell a patient who does not want to have bottles of pills in their house? We all know they have to take a B12, and vitamin D is always recommended, but I find it very difficult, especially when patients are panic-stricken about stopping to eat fish. We have patients who are willing to have small amounts of fatty wild-caught fish. And then we have others who will not take supplements. So I'd like to hear the panel's experience. Thank you.
I mean, I don't think it's actually, it's very clear if you have to take a supplement for omega-3, but it makes sense to, which is why we do recommend it. Omega-3s are naturally found in chia seeds, hemp seeds, walnuts, and you get the short chain omega-3s in that when you consume it through these plant foods. And then we expect that your body will convert that to the long-acting omega-3s. But there are some people who don't convert, and we don't know who are those people who are good converters or bad converters. And for that reason, we do recommend people to take an omega-3, but it's not so clear. It's not a clear recommendation that you have to take an omega-3.
Yeah, a similar sentiment, and a couple of quick points. In regard to the fruit question earlier, or the sweeteners, I do look at fruit as grown-up sugar. And we, in the American Journal of Medicine, I think it's called Nutrition Controversies 3, there's a small section about the evidence for and against artificial sweeteners. And I believe Dr. Aaron Michos wrote an omega-3 review, maybe more from a cardiovascular perspective, but we hit up against this hurdle all the time in the cardiac literature. There's some evidence that eicosapentatic acid in the REDUCE-IT trial may be helpful, but the STRENGTH trial that had overlapping things did not show benefit. So there's some controversy in the cardiovascular literature. And people don't always convert the ALA from hemp seeds, chia seeds, ground flaxseed meal well. So in my program, although I do encourage people to have those things, I do also encourage an omega-3 supplement, not really for cardiac health, but because I think it's going to be helpful for brain health.
I used to supplement with DHA, EPA, but now I just eat walnuts.
With that, I appreciate the panel's time. I think we had a really insightful discussion, and I appreciate everyone's questions. Thank you all so much for attending this session, and I think we're going to move on to the next thing. Thank you.
Hi, there'll be a little coffee break until 2:40 and then we'll meet back here.
So if you're gonna